Okay, so I'm here with Dr. Palacios once again, and we're going to have another little discussion about a topic that may be of interest to people, hopefully. We're going to talk a bit about low back pain. We've talked about some other topics in the past, so we're going to talk about low back pain today. So, welcome once again, Dr. Palacios.
Thank you very much.
You're welcome. So let's just talk a little bit about the problem of low back pain and maybe some of the sources where how people end up with low back pain.
Well, yes, low back pain is another important health issue all over the world, in America, of course. Uh, it is important and has different sources. For example, lesions in sports, lesions in the theater. We have seen patients that do special kind of theater that needs certain kind of activity, like in the circus, for example, and they got big lesions. Also, there are lesions in automotor vehicles, which is one of the most important causes, and also related to the way people behaves, the way they sit, the way they sleep, the way even they walk. And also we have cases of low back pain related to neurosurgery. For example, in the case of different alterations, different kind of malformations in the discs of the spine.
Hmm.
So there are different causes.
Uh-huh. And so when people end up with back pain, do most of them go for treatment, or do many people not go for treatment?
No, many most of the patients first consider it as things of the life. So this is a pain. Maybe they will go back someday. I will take a certain kind of painkiller and see what happens.
Hmm.
But the most important thing here is that people let it go through. They do not pay any attention, and then one day it became chronic, really chronic, because it alters, changes all the way of life, the way they sleep, the way they sit. They use the different kind of conditions related to life, the way they work, the way they use their shoes. So
Hmm.
everything is related to that pain, and the pain became more chronic every day.
And is it harder to then treat if it becomes chronic?
Yes, it is more difficult with the conventional treatment, and also uh, there's another issue which is very important. There are many people became painkillers addict.
So they get addicted to the
They get
painkillers.
addicted to the painkiller, and this type of addiction, if you can call it that way, makes more difficult to overcome the problem, even if they are with the appropriate treatment.
Hmm.
So yes, it is important in because all of these reasons.
Hmm. And what are some of the treatments that are available?
Well, of course, painkillers. There are also surgery. There's also different types of massage. There is also different types of orthopedic devices. A lot of physiotherapist work, which is very important, but many people do not like it because they have to work and the effect do not comes immediately.
Hmm.
So they abandon this type of treatment, which is important, very important. I do believe that um, biofeedback, neurofeedback, and physiotherapy are the most effective treatments for low back pain, but people do not use it very much.
Now, which biofeedback modalities are recommended?
Well, I like to work with all modalities, but in these cases, the treatment is based on EMG modalities. You can use two channels, up to four channels of EMG, quantitative surface EMG, which is very, very effective. You can work also with temperature, which is related to the acute process of pain. In this case, it's an important measure of this acute process. And in some cases, you have to work with respirations because people has to become more awareness the way they are responding to the pain,
Hmm.
and by the way, also skin conductance. So I used to do multi-signal profiles and multi-signal sessions in the treatment of pain. And of course, you have to work also with neurofeedback related to certain kind of states related to alpha activity that can be like self-anesthetic states, which helps a lot to overcome pain and to prevent the next episode of pain. This is an important point also.
Hmm. So it's interesting all of the different modalities that you've mentioned, because many times people would think of with the back,
Mm-hmm.
they may think of the muscles, and so the EMG measuring the muscle activity, that they may logically think that you would use the EMG with the back, but some of the other modalities, they may not see the connection, right?
Yes, at the beginning they do not see the connection. In fact, some specialists, not only in the field of biofeedback, but also in the field of neurofeedback and in the field of medicine in general, physicians do not see the relation, for example, between muscular tension and arousal.
Hmm.
So we have to treat both, not only muscular tension, because sometimes arousal triggers muscular tension, and then
Hmm.
the pain starts. But the others, muscular tensions, chronic muscular tension, triggers many arousal, and it becomes a vicious circle between one another. So we have to treat both.
Hmm.
We have to think that all things are happening in the same body and in the same brain. So we have to treat the whole components to get a more effect response.
Hmm. And you mentioned about the EEG and alpha. What's the connection there?
Well, there are different connections. First of all, with the effect of arousal and chronic pain reactions. Many people became with a less voltage of alpha in the occipital and the parietal zone.
Hmm.
They are more alert. So these have a particular effect in the perception of pain, the integration of pain, and it becomes much more easier for the pain response to get established, not only in the peripheral, in the autonomic and peripheral nervous system, but in the central one.
Hmm.
The second reason is that this kind of brains, if we can see the problem like this, do not have a proper rest, do not come overcome the daily work with a little bit of rest during the day. And the other point is that it has been demonstrated since many years ago from many important people in the field of neurofeedback that the prevalence of synchrony, coherence, and symmetry of alpha waves can produce an state that gives self anesthesia,
Hmm.
reducing pain, or preventing when it is the natural and normal organization of pain,
Hmm.
of alpha, excuse me. So pain will become a problem, or will become a problem that it is much more easy to handle, no matter the patient is not near the physician or the specialist, because if he knows how to manage, for one side, arousal, and for the other side, the prevalence, the organizations, the synchrony, symmetry of alpha by feeling it, of
Hmm.
alpha waves. Well, this will be a general psychophysiological state that prevents pain,
Hmm.
that prevents the next episode. When the time is passing through, I would like to say that the brain learns how to maintain pain away, how to get a self defense of pain. First of
Hmm.
all, in all these cases, we have to consider the proper work of other type of specialists that can see the patient and look for other causes of the pains. That's an important point of view, because if we are working with biofeedback and neurofeedback, we receive the patients after the other specialists have confirmed there's not another source of pain,
Hmm.
but only the ones that are the most common to work with, biofeedback and neurofeedback.
Okay.
So it's an interesting work. It is about, I don't know, maybe 30 hours of work
Hmm.
with both perspectives of work. And it's nice. You really like it. I remember just now a patient that came to the office with many kind of helps.
Hmm.
He was to be help to sit, to stand up. He uses different kind of helps to walk. He got an injury playing football, soccer,
Hmm.
and after the treatment, he went walking normally and feeling much more better with no relapse of the pain problem.
Right.
Yeah, this is an interesting protocol for the treatment of pain.
Great. Well, this has been very interesting. So, thank you for all the information, and we'll definitely talk about some other topics coming up soon.
And thank you very much. My pleasure to doing these interviews.
Okay. Thanks.
Thanks.